Hello everyone. So today we will be discussing the second part of metabolism, and that is the cytochrome P450 enzymes. So what are these cytochrome P450 enzymes? These are one type of microsomal enzymes. And we have studied previously that these microsomal enzymes are found in the smooth endoplasmic reticulum. Okay. So what is meant by this P450? So this P stands for pigment and 450 stands for that this pigment absorbs maximum light at wavelength of 450 nanometer. Okay, so now coming to the nomenclature of this P450 enzymes. We know that there are various kinds of cytochrome enzymes, CYP enzymes. These are named as CYP3A4, CYP2D6, CYP2C19, and so on. Okay, so what does these things mean? So CYP means cytochrome. Then the very next letter after that, that is for example CYP3A4. This 3 means family to which the enzyme belongs. Then A means is a subfamily, and this last letter 4, that means the isoform of the enzyme. Okay, so most of the drugs, they are metabolized by CYP3A4 followed by CYP2D6. Okay, most of the drugs, they are metabolized by CYP3A4 followed by CYP2D6. Now, how will you remember the drugs which are metabolized by CYP3A4? There's a beautiful mnemonic so that you can remember. It is TCS can. Okay, so inside TCS, we will have to remember T for tacrolimus, C for cyclosporine, S for statins, then C for CAD group of drugs, CAT. These are cisapride, estemizole, estemazole, and terfenadine. So these drugs, these have been withdrawn from the market because of QT prolongation. Okay. The next A is amiodarone and N is navirs, like ritonavir. Okay. So these are protease inhibitors, and they are used in HIV. So these are the drugs that are metabolized by CYP3A4. It is TCS-CAN. So T for tacrolimus, C for cyclosporine, S for statins, again C for CAT drugs. In this CAT, you will remember cisapride, estemazole, and terfenadine. These three drugs, cisapride, estemazole, and terfenadine, these prolong the QT interval. Therefore, they have been withdrawn from the market. The other drugs are amiodarone and navirs, that is the protease inhibitors. Now coming to the drugs which are metabolized by CYP2D6. So 2D6, how will you remember? I remember it by means of 2 4 6. Okay. Though this 2 means the second letter of the English alphabet, that is B. So B for beta blockers. Then char, for char you will remember chore. And whenever there is chori, you go into depression. So when there is depression, you will give the drugs like TCA, tricyclic antidepressant, SSRIs, SNRIs. Okay. And 6. Whenever there is a 6 being hit in the cricket, then there is increase in the heart rate. With increase in the heart rate, you will remember arrhythmias. Okay. So anti-arrhythmic drugs, they are metabolized by CYP2D6. And this anti-arrhythmic drugs, except one drug that is metabolized by CYP3A4 is, that is amiodarone. So all the anti-arrhythmic drugs except amiodarone, they are metabolized by CYP2D6. Apart from that, antidepressant drugs like TCA, SSRIs and SNRIs and beta blockers, they were metabolized by CYP2D6. Next, coming to the drugs which are metabolized by CYP2C19. So the drugs metabolized by CYP2C19 are clopidogrel and ticlopid. So these two drugs, they are metabolized by CYP2C19. So one important drug interaction which you need to remember with, as because this clopidogrel is metabolized by CYP2C19 and this is a prodrug. So clopidogrel will be converted into its active form. Okay. Now this CYP2C19 is inhibited by PPIs and the maximum of the inhibition is by omeprazole. So in question it can be given that suppose a person post-MI patient is taking clopidogrel as prophylaxis and uh, there is therapeutic failure of clopidogrel. That means the clopidogrel is not working. Which of the following drugs might have caused this condition to happen? And within the option there might be PPIs or omeprazole. So here this is the reason for that answer. Okay. So as because clopidogrel is a prodrug and it is converted into its active form by CYP2C19, whenever you give PPIs which are the inhibitors of this CYP2C19, there will be therapeutic failure of clopidogrel or clopidogrel will not be able to act as because it is not being converted into its active form. Okay, and this is maximum by omeprazole and minimum is by rabeprazole. So if at all you need to prescribe a patient with PPIs, whoever is taking clopidogrel, then you will have to give rabeprazole and not omeprazole. Okay. So this was all about the cytochrome enzymes. So this completes the metabolism chapter. Okay. So quickly revising, the cytochrome P450 enzymes are microsomal enzymes and they are located in the smooth endoplasmic reticulum. And this P stands for the pigment and the maximum light at wavelength of 450 nanometer is being absorbed by these cytochromes. So the nomenclature is the CYP stands for cytochrome. The next letter after that stands for the family and the next letter after that stands for the subfamily. And the final number stands for isoform. Now, what are the drugs which are metabolized by CYP3A4? Most of the drugs are metabolized by CYP3A4, and this you can remember by the mnemonic TCS CAN. Tacrolimus, cyclosporin, statins, CAT, that is cisapride, estomazole, and terfenadine, then amiodarone and navirs. Out of this, the CAT drugs, they cause the QT prolongation and therefore they have been withdrawn from the market. Then the drugs which are metabolized by CYP2D6 are 2 stands for the second letter of the alphabet, that is B, and B stand for beta blockers. Then 4, there is Curie. Whenever there is Curie, there is depression. Okay, so antidepressant drugs, and the 6 for arrhythmias, this anti-arrhythmic drugs except amiodarone. Then CYP2C19, there are two drugs which are metabolized by CYP2C19, important drugs that are clopidogrel and ticlopidine, and another important drug interaction which takes place with them. Okay, clopidogrel, whenever it is given along with PPIs, there will be therapeutic failure of clopidogrel because of inhibition of CYP2C19. So that's all. Thank you.